Hi, I'm Dr. Tom LaGrelius, a family practitioner and geriatrician in Southern California, and I'm going to talk to you today about gout. Gout is actually a subset of the subject acute monoarticular arthritis, which means that there's a sudden onset, it's acute, it's in one joint at a time, one joint, monoarticular arthritis. You know, doctors like to use Latin words to say things that you could say just as easily in English, and we learn a lot of these Latin words so that people will think we know more than the general population. But it just means one joint that's acutely and suddenly inflamed and hot. There are several things that can cause acute monoarticular arthritis. One of them is joint infections. So it's very important to try, when you have one of these hot, red, suddenly inflamed joints, to put a needle inside the joint and get the fluid out and make sure that the fluid inside that joint is not infected, because acute infections of joints can look just like gout and be very dangerous and are not treated at all the way gout is treated. There's a disorder called pseudo-gout, which is actually another Latin word, which simply means false gout. It's caused by calcium crystals in the joint, and the joint usually has pre-existing wear and tear or osteoarthritis, which allows these calcium crystals to deposit, and that looks just exactly like gout too, and pretty much is treated very similar to the way gout is treated. But gout is the sudden deposition of uric acid crystals into a joint. Now, uric acid is a kind of an insoluble chemical that floats around in your bloodstream, and the fluid can't hold very much of it. It tends to precipitate out into a solid crystal. You can imagine putting some salt in a glass of water. You keep putting salt in the glass of water till no more salt will dissolve and the salt settles down in the bottom of the glass. That's kind of what's happening with gouty crystals. They settle down in the bottom of the joint. And the reason they do that part of the time is because the joint is colder than the surrounding tissues. That's why gout is most common in the toe. The toe is cooler. And sometimes trauma will set off the crystal depositions. But for whatever reasons, these crystals suddenly precipitate out in the joint, and you can imagine what happens to a joint which suddenly has gravel in it. The body recruits all kinds of inflammatory kinins and white blood cells to try to chew up the crystals, and it gets hot and red and inflamed extremely rapidly. And these joints are so painful that you can't even touch them or lay a sheet on them sometimes. It's important to get to medical care when that occurs quickly, because once it's fully established, it can really damage the joint. And your doctor, when he sees you with an acute problem like gout, should try to put a needle into the joint and aspirate the material and look for crystals to see if he can see these gouty crystals in the joint, see if he can see pseudo-gout crystals in the joint. But most importantly, to make sure the joint is not infected by looking at it under the microscope for bacteria and white blood cells and to culture it to make sure it isn't infected. Once they've established that it probably isn't infected, gout can usually easily be treated with oral medications. Usually we use non-steroidal anti-inflammatory drugs that are related to aspirin. We usually don't use aspirin, we use other kinds of similar medications. Quite often we use Celebrex or Indocin, things that will stop the inflammatory process. Gout can be prevented in a number of ways. There are several drugs that can be used to prevent gout by lowering uric acid levels or by making the kidney get rid of a lot of that uric acid. There are a couple of drugs. Allopurinol will block the production of uric acid, and there's a new drug which is a lot safer but a good deal more expensive called Uloric, which will block the production of uric acid and lower uric acid levels and prevent gout. So if you don't want to be one of those people like you see in the cartoons, the overweight aristocrat sitting around with his toe wrapped in a bandage up on a footstool having an acute gout attack, you want to keep your uric acids kind of low. Thank you.